Clerk will enable the roll call.
Senator Obenchain.
Chain's here.
Okay, what I'm going to do first, we have some bills that I'm going to assign to a subcommittee, and the Energy Subcommittee will meet when we conclude today's business. That's Senate bill, going to Senator Spruill's subcommittee, Senate bills 120, 160, 267, 280, 304, 347, 505, 625, 659, and 660. All right, and the subcommittee, we've got a labor and employment subcommittee that'll hear a lot of these bills. If you, I know, and I'll tell you what they are, and they're going to go to a subcommittee. Senate Bill 1, okay, I think that's you. Senate Bill 15, Senate Bill 331, 352, 365, 427, 624, and 631. Senator Servell's subcommittee, is he here?
He just had to step out to present a bill.
All right, and that subcommittee will be he and Senator Newman and Senator Marsden. And they'll work out the starting time and then notify everybody. All right.
Mr. Chairman,
Now,
for my subcommittee, the people are aware of these already, so I can do mine without the,
pardon?
we can do mine after the full section because
Yes,
they're aware of them already.
Yeah, all right.
Thank you, sir.
And then,
Mr. Chairman, Senate Bill 267, electric cooperatives, I think it was one of those bills. I'd like to ask that we strike that bill,
okay.
so we don't waste any energy
All
in
right.
it.
All those in favor of striking 267, vote aye. All right. All right, now, at the request of the patrons, these bills will go by for the day. Senate Bill 204, Senator Peterson. Senator 338, Barker. Senator 344, Senator Barker. Senate Bill 374, Senator Obenchain. Senate Bill 376, Senator Peterson. Senate Bill 405, Senator Barker, and SB 407, Senator Donovan. All right. The 407. All right. The first bill is the workman's comp bill that I put in at Senate Bill 181, and I'll give it from here, but Senator Lucas should take over. Last year, I got a bill through dealing with the COVID and its relationship to the firefighters. And we, during the special session, we had dated it back to September of this past year, or of 2020. And then the governor amended it, Governor Northam amended it, and put it back at July 1st. We agreed to that of 2020. What I've done, though, is say that if you do not get the vaccinations, what this bill says, you don't get the vaccinations and you come down with COVID, you don't get workman's comp. If you turn down the vaccination and you get COVID, you don't get workman's comp. That's the bill.
Are there members of the audience who would speak in favor of the bill?
If you're in the Zoom room and would like to speak in favor of the bill, please raise your hand electronically now. Madam Chairman, there is no one wishing to speak.
Thank you.
Mr. Chair, members of the committee, I'm John Hurd here today on behalf of the Virginia Self-Insurers Association and Metis Holdings, Inc., which is the company that oversees the administration of all the workers' comp liability claims against VACO's risk pool. We do support this bill as currently drafted. It's only fair that the groups favored with this presumption must take the vaccine in order to be eligible to utilize the presumption in proving their case. Without that presumption, it's very difficult for them to prove that they contracted this very communicable disease during and in the scope of employment. And by taking the vaccine, they can help lower their own probability of contracting the disease, which in turn keeps the employer's costs down and keeps these employees at work on the job. So thank you, Mr. Chairman.
Thank you very much. The next speaker.
Madam Chair, Aaron Rice on behalf of the Virginia Professional Firefighters. We also support the legislation. We have been strongly encouraging our members to get the vaccine. We think it's very similar to occupational cancer and making sure all of your equipment and you do everything that you can to prevent illness. And we think this is just the same thing. So we support the legislation and thank the Senator for introducing it. Thank you.
Thank you very much.
Madam Chair, Ed Rhodes, representing the 13,000 members of the Virginia Association of Rescue Squads, along with the Virginia EMS Administrators and Virginia Ambulance Association. And for all the reasons given, I'm going to keep it short. We support this bill and thank the Senator for bringing it forward.
Thank you for speaking.
Hey, good afternoon. Andrew Lamar, representing the Virginia Nurses Association. I only wanted to point out that the specific provisions in the Senator's bill were also included last session when you all took this up in a bill specific to healthcare workers, when that bill was adopted unanimously by the General Assembly. So you did this already for healthcare workers, and just wanted to note that. Thank you very much.
Thank you very much. Are there those in the audience who would speak in opposition to the bill?
If you're in the Zoom room and you would like to speak in opposition to the bill, please raise your hand electronically now. Madam Chair, we have 2 speakers.
Thank you. Please hear them.
Vic Nichols, please unmute and begin your testimony, followed by Patricia.
All the insurance people and fire people also. Is this your? Yeah.
Vic Nichols, please begin your testimony.
Thank you. Number one, let's be very clear. Being vaccinated does not exempt you from getting COVID in any way, shape, or form. Let me give you one example that actually shows this very well. This happened to be out of Scotland because I look all over to see what trends are everywhere. If you took a look, they have it split out into unvaccinated, 1 dose, 2 dose, and the 2 doses and the booster. And for 1 week alone, let's take January 1st to January 7th in 2022, the regular vaccinated folks had 2,418 age standardized case rate. For a booster and 3 doses, it was 1,361. For 1 dose, it was 1,393. But for the unvaccinated, it was 923. There are obviously differences in how the vaccination works. It is very obvious that Omicron can bypass it. So we really need to take a look now. Maybe back then, a year ago, we knew something different. But now Israel has a load of vaccinations, and they've already done 4th shots for their over 60. Let's go by the science, and it's not there now. For that reason, I ask that you PBI this bill. Thank you.
Patricia, please unmute and begin your testimony now.
Speaker has 3 minutes. Speaker has 3 minutes.
Oh, thank you very much, Chairman. I sent everybody on this committee email. My thinking on this, there's 2 kinds of medicine, Western medicine, and it's called allopathic medicine and homeopathic medicine. Allopathic medicine does surgery, and then, if you're in pain, they give you medicine for pain. That's what it is. Now, this vaccine fits into the category of allopathic medicine. And Pfizer closed at $308 billion. J&J at 434 billion, Moderna at 69 billion. I think that is inappropriate for insurance companies to make their determinations, payouts based on the treatments that a patient chooses.
Thank you for your testimony.
Thank you.
Okay, I'll wrap it up.
Senator Saslaw?
Let me just say this.
Let me ask first if there are any comments from any member of the committee. Seeing none, Senator Saslaw.
A couple of weeks ago, there were 96 or 95% of the people hospitalized for this at Inova were unvaccinated. The people who have had the 2 shots and the booster who do come down with this are generally back at work in 10 days. Now, it's one thing to pay workman's comp for 10 days. It's a whole nother thing to pay it for 3, 4, or 5 months. And that's the difference. And that's why I put this bill in, to hold down these insurance costs. So with that, Madam Chairman, I would hope that we would report the bill, and I'd so move.
Second. It's been moved and properly second that the bill be reported. All in favor, please so designate on the electronic voting board.
Senator Obenshain, how do you vote?
Obenshain votes no.
Ayes 13, noes 2.
Ayes 13, noes 2. The bill is reported.
Thank you. All right. Let me have this. All right, Senator Chase, you have Senate Bill 189.
Thank you, Mr. Chairman and members of the committee. This is Senate Bill 189 pertaining to employer-mandated vaccinations for COVID-19 and ensuring that our employers do not discriminate against employees who make the decision not to get the vaccine. Mr. Chairman, one of the things that concerns me is that we have a one-size-fits-all prescription. We're saying that COVID is the only treatment that is successful for the treatment of COVID. And as you will hear from different testimonies, there are people who have been treated by using other known therapeutics, monoclonal antibodies, hydroxychloroquine, and ivermectin, which have unfortunately been politicized. My aide who is in here today, who's returning for the first time today, severely suffered from COVID and has fully recovered under the care of medical treatment and the use of ivermectin and hydroxychloroquine, and I'd like him to stand today. Shane? No more issues with COVID still going to mandate. We're making the assumption that even 5-10 years from now that we're going to still have COVID, and I hope to God it's not here anymore. But this is a solution that's in search of a problem right here. And we're talking about autonomy and making decisions over your body. We need bodily autonomy, personal decision, and access to safe and legal health care. I would be very concerned if we dictated a one-size-fits-all prescription. If I look at some of the other vaccines that have been passed on the, we look at the measles vaccine, which was produced in 1963. We look at the MMR, which mumps, measles, rubella, 1971. This vaccine has not even been around for over a year, and it's still considered experimental, and we still don't know the long-standing issues of women who are pregnant and all types of issues. I would say this, Mr. Chairman. Many Virginians, they don't want to get the COVID vaccine. And why are we forcing Virginians to get a vaccine against their will? Virginians are being forced to choose between getting a jab and keeping their job or losing everything. A July 20th through August 2nd of 2021 Gallup poll showed that more than a third of Americans, or 1 in 3 Americans, would refuse a free FDA-approved vaccine even if it were readily available. Ask if they would get such a COVID-19 vaccine, 65% say they would, but 35% would not. So why are we forcing Virginians through forced coercion to get a vaccine against their will? Sounds a little bit like some who are fighting saying that they support abortion. Virginians have a right to say no to coercion and forced vaccination. By law, no employer or business entity has any legal right to mandate. And most recently, Mr. Chairman, in January of 2022, the Supreme Court rules against the OSHA large employer vaccine mandate. They did uphold the mandate for the healthcare workers, but now we're seeing a created crisis here, a self-inflicted wound, if you will, creating a shortage of healthcare workers who are resigning because they have educated themselves and make a conscientious decision not to get the vaccine. And in fact, October the 3rd of 2020, several hundred Virginia healthcare workers have been suspended or fired over coronavirus vaccine mandates. So, Mr. Chairman, I would tell you, this is also affecting our rural hospitals, all of our hospitals everywhere, because they cannot, healthcare workers are having to quit or choosing to quit because they refuse to get the vaccine. And there are just so many other options now and developing that I think that if we have this one-size-fits-all strategy, I think long-term it's going to adversely affect Virginians. Thank you.
Okay. Are there those in the audience in support of the bill? And we're going to give each speaker, each side total 3 minutes. That includes the people on the virtual line. Go ahead, sir.
Thank you. My name is Will Shaw. I live in Louisa County. I don't represent a group or organization. I'm retired, so an employer mandated pharmaceutical one way or the other isn't going to affect me directly. However, I do have 3 daughters, and they're all employed, and they'd like to stay employed, and they'd like to have the bodily autonomy. We heard senators speaking about just minutes ago on the floor of the Senate. I'm not against vaccines. I mean, I get the flu vaccine every year. I've had the shingles vaccine and so forth. People shouldn't be coerced and compelled to take an experimental pharmaceutical. It's just wrong. Thank you.
Next.
Yes, I'm Russell King of Annandale, Virginia. I'm speaking in favor of SB 189. I believe most of the COVID vaccines use either cell line HEK 293, which uses harvested kidney cells from human fetuses, or PER.C6, which uses harvested retinal cells from human fetuses. Both of those in the Netherlands at Leiden University in the 1970s and 1980s. I think you need to look into this. I believe that religious exemptions are good for religions that believe in the 6th commandment, but I do not think they should be necessary. I believe for any reason whatsoever, the vaccine should be refused. And I believe the United Nations has a statement of opposing medical coercion as well. Thank you.
I would just like to say one thing that should at least allow this bill to be put before the Senate. What happened to my body, my choice? Everybody, especially on the left, always talks about my body, my choice. Well, how about letting people have their own choice?
All right. Halted at 40 seconds. That's all that you'll have left if there's opposition on the phone, okay, on the line. Are those here in opposition to the bill?
Mr. Chairman, we have individuals online in support of the bill.
Well, okay, well, let's go ahead and deal with them first. You've got, how many are on the line?
There are 5 online, sir.
They each have about 10 seconds. Just say whether you support it or and that's about it.
Vic Nichols, please begin your testimony.
I support this bill so that myself and others can keep our jobs. Thank you.
Okay, thank you. Ms. Runyon, you're next.
Yes, we represent airline employees for health freedom. Over 2,000 United employees have been discriminated and retaliated against by a private employer mandate. Forced coercion is the result of these mandates, and therefore we are in support of this bill.
Thank you. Ms. Boston, you're next.
Susan Boston, UVA nurse for 26 years, have been released from my job after all kinds of good reviews, have worked hard for UVA, and I support this bill as the freedom of my choice.
Thank you. Mr. Holbrook, Matt Holbrook, you're next.
This is Sandra Holbrook. I'm a licensed physical therapist in the state of Virginia, and one's bodily autonomy is a fundamental right that should not be taken away. I support SB 189.
All right, and finally, Patricia from Arlington County.
Thank you very much. I support this bill as I do the Bill of Rights in the state of Virginia in pursuit of happiness. And I don't need to take a vaccine. Thank you very much.
Thank you. All right, those who are in opposition to the bill that are here.
Mr. Chairman, members
Each side has 3 minutes.
Mr. Chairman, members of the committee, Brent Rawlings, Virginia Hospital and Healthcare Association, we oppose the bill for two very practical reasons. The first reason is we are currently subject to a federal requirement. Hospitals are. Centers for Medicare and Medicaid Services have passed a rule requiring all hospitals to have 100% vaccination or an exemption for all of their staff effective January 27, 100%. First dose, 100%, second dose by February 28th. This will apply going forward on for all any new employees. Second main reason, we want to do anything possible we can to ensure the safety and health of our workers and our patients. First and foremost, that's our paramount obligation. Given the volume of hospitalizations we've had over the past couple of surges, it's unfathomable to think how we could possibly have sustained this with our healthcare system without the vaccination. So we are in opposition. The last thing I just want to mention to all of this is we do support exemptions, religious exemptions, as well as medical exemptions, and those are granted liberally as needed. Thank you.
Next.
Mr. Chair, very briefly, John Hurd again on behalf of the Self-Assurers Association and Metis Holdings, Inc. We oppose the bill because it's going to put employers at a great disadvantage or punish them for exercising their rights already spelled out under the statute I just testified on your bill, Mr. Chairman, 402.1 in the Workers' Compensation Act, which deals with infectious diseases. Under that section, an employer defending a workers' comp case is entitled to insist that the claimant be vaccinated. In order to utilize that presumption under this bill, that could easily be construed to be discriminating. We ask that you not report it.
Okay. Is anyone online in opposition?
If you are in the Zoom room and would like to speak in opposition to the bill, please raise your hand electronically now. Mr. Chairman, we have 2 speakers.
Okay.
Lisa Salad, please begin your testimony.
This is in opposition. All right, so they're not responding.
Mr. Chairman, Lisa Stein with Virginia Education Association, and we oppose this bill.
Okay, thank you. Anyone else?
Mr. Chairman, that is the only speaker.
All right. That's it. On the committee now, comments?
Yeah, Mr. Chairman, if I might.
Sure.
I just have a comment. I think this bill is a threat to the public health. The senator mentioned hospitals or no medical or hospital or hospitality or airline should be forced to employ people who would be more likely to transmit and perpetuate this highly communicable and deadly disease. And for that reason, I have a motion at the appropriate time.
Let me just say this. I'm old enough I was 15 or 16 when that Salk vaccine came out. You didn't get that. Your community essentially declared you legally dead. You couldn't even go to school. No ifs, no ands, no buts. Wrap it up.
Mr. Chairman, under federal law 21 U.S. Code 360 BBB-3, it clearly states that no one, no government, military, academia, business, healthcare, unions, no one has the right to mandate anyone to take an experimental vaccine. And that's the thing that I want to emphasize. This is an experimental vaccine. These vaccines are under the emergency use authorization, every one of them, which means they are not approved by the FDA.
Okay. All right, committee ready to vote? Is there a motion?
Move to PBI.
Mr. Chairman.
Senator Newman.
Mr. Chairman, Amanda, I'm just struggling with everything after A, right? All these penalties on businesses and that type of thing to me is just, it's a lot, right? And there's no my other concern is the Supreme Court has spoken about some of these healthcare workers, and man, that makes it rough. And so how do we get around all the fees and what the Supreme Court has said?
Thank you, Mr. Chairman. And Senator Newman, I would answer you by saying this is a law that was actually passed in the state of Florida, and which is where the bill was actually originated. And in order for employers to comply, it has teeth in it to encourage that there is no discrimination and there's a penalty therefore associated. This is no different than the law that was passed and signed into law in Florida.
Mr. Chairman, I'm sure this committee's not going to pass this bill, and therefore I'm not going to try to amend it up. But just, I think it's some laudable things to not have people get fired from their jobs in non-healthcare areas when they maybe have an exemption or have had COVID and that type of thing. But I just don't think it's fixable in this amount of time. So thank you.
All right, the motion is to PBI. A second. All those in favor of passing the bill by indefinitely, vote aye. Those opposed, no.
Senator Obenshain, how do you vote?
No.
Clerk, close the roll.
Ayes 12, noes 1, 1 abstention.
All right, the bill's defeated. Thank you, Senator. All right, next is Senator Mason here? Senator Donovan has requested that her bill, which is pretty much similar to yours, be folded in to yours. So I need a motion to fold 549 into 195. Second. Okay. 549 into 195. All right, all those in favor of that, does that have to be recorded? Okay, vote aye.
Senator Obenshain, how do you vote?
Senator Obenshain votes aye.
All right.
Ayes 14, no 0.
Senator Mason, you're up.
Thank you, Mr. Chairman. Mr. Chairman, Senate Bill 195 is something you've seen before. It passed out of the Senate 35-2 in the 2020 session and passed the House of Delegates as well, and was then vetoed by the governor. So regardless of what happened in the gubernatorial election, I was going to bring it back again this year. This is a multiple employer welfare arrangement that is designed to set up opportunities it's intended for groups from 2 employees to 50 employees. And if you go to line 75, if you're looking at the PDF from line 81 to 92, this is the structure of the organization, and I want to point out a couple of things. Back on line 67, health benefit plan has the same meaning described in 38.2, 3431. That is the state code for the Affordable Care Act. So down it speaks to having the same essential health benefits and cost sharing requirements as the Affordable Care Act. Number 3, line 83, not limited to exclude coverage for an individual by imposing a pre-existing condition exclusion. Therefore, it covers pre-existing conditions. You would also, in line 85, be prohibited from establishing discriminatory rules based on health status or eligibility. And then finally, on line 90 to 92, it speaks to the format. We're going to have a larger pool, which could be upwards of 20,000 people, that each year you're going to recalibrate based on the larger pool of people, and then a smaller pool, which is going to be your company, between 2 and 50 people. And if your company has 7 people, we would then look to the year of health experience in that smaller pool, and that's described on lines 90 to 92. A couple of quick other things to point out, Mr. Chairman. Over on line 361, if you're following the PDF, this sets up sponsoring associations that can go and set up this bill, that set up this organization, this group. So they are not designed for healthcare. There are other organizations. In this case, the Chamber of Commerce has asked for me to carry this. But you'll see over on lines 374, we added 2 years ago 501c5s. That covers the Farm Bureau and agriculture organizations, and 501c6, which are chambers and other nonprofits. Finally, Mr. Chairman, the meat of the bone is over on starting around line 802. This is actually a trust. So this will be set up as a trust with a board of trustees that will meet and determine how it operates. You will see on line 825 that all funds through the trust are used for the benefit of the participating employee. So at the end of the year, if there are excess reserves, or we call them profits in the real world, you don't distribute the profits. They have to go back to benefit the members of this group. Lines 841 to 846 speak to the reserves needed, the retention levels, guarantees, letters of credit. You need at least $4.5 million to get this started before you begin paying in premiums and covering those that are falling under the opportunity. So you've seen this before. I'm happy to answer any questions that you may have or go through it in further detail, but I'll stop there for now, Mr. Chairman.
Mr. Chairman. Senator Mason, how does this differ from the 4 other versions of this we've seen?
Well, there are 2 distinctly different bills. This is the one intended for groups of 2 to 50.
Okay.
And the other will include individuals. That's the difference of what you're going to hear today. But from what you heard 2 years ago, we cleaned up some language and made some this and days, but nothing. Mr. Chairman and Senator Lewis, thank you, sir.
Thank you, Mr. Chairman. I think it was the governor's veto based on the fact that the more of these plans there are, I guess a pool is created of the hard to insure, and just makes that more and more difficult. Was that the extent of it?
Mr. Chairman, Senator Marsden, there were several discussion points along the way that it didn't cover pre-existing conditions and treat everyone equally, which we've tried to address here. That it would, in fact, if you had people in these pool coverages, to possibly draw away from the ACA. But I point out to you, sir, that the ACA and these plans are designed when you can't get coverage for the individual. You cannot set up for a group, 2 to 50, in that. Those are designed to bridge you until you get into a pool of different coverage. So we felt like it was invalid, but that was, in fact, what they were leaning on.
Thank you.
Thank you, sir.
All right. Any other questions? Anyone here in support of the bill?
If you're in the Zoom room and would like to speak in support of the bill, please raise your hand electronically now.
Good afternoon. My name is Ken Penn, and I'm with Affinity Benefits Consulting, and I've worked with the Virginia Chamber of Commerce and Monty Mason over the past 3 years, and I represent the Virginia Chamber of Commerce today and their 28,000 business members. Over the course of the past 3 years, we've had the opportunity to work with health policy experts, plan administrators, associations, small business members, and insurance agents alike to craft this legislation. And then our last piece of the puzzle was the Bureau of Insurance, and we in fact had robust discussions with the Bureau of Insurance to ensure that all of their concerns were met. And at the end of the day, we ended up with legislation that provided consumer protections, coverage standards, solvency requirements, regulatory authority, and oversight requisites. In other words, all the guardrails are in place that provide for quality, affordable health care coverages for small businesses in Virginia as an alternative to the Affordable Care Act.
Thank you, Mr. Chairman. Terry Durkin with the Roanoke Regional Chamber of Commerce, and we support the bill. Thank you.
All right.
One more. Mr. Chair, members of committee, good to see everybody. Emily Reynolds with Access Point Public Affairs representing the Greater Williamsburg Chamber, and we support the bill. Thanks so much.
Mr. Chairman, Ben Rose speaking on behalf of Virginia Farm Bureau. We support the bill. Thank you.
All right. Anyone in opposition? Two online?
Yeah, Mr.
Favor. Oh, in favor. Oh, you're in favor. Okay. Mr. Marcoux.
Hi, my name is Stephen Marcoux. I'm speaking on behalf of the Arlington Chamber of Commerce, and we strongly support the bill.
Thank you so much.
Ms. Howard, please unmute and begin your testimony.
I was not online to speak on this bill. I was online to speak on Senator Chase's bill 198.
I'd be happy to address any questions you have, Mr. Chairman. I think it's covered up.
I think we pretty much covered it. Need a motion.
So-
This has to be reported, and the motion should be, and go to finance.
Report and go to, and refer to finance. Second.
All right, all those in favor of reporting and referring to finance, vote aye. Those opposed, vote no.
Senator Obenshain, how do you vote?
Aye.
Ayes 15, no zero.
Thank you, Mr. Chairman. Members Cooney.
All right, Senator McPike, you here? 226.
Thank you, Mr. Chair. Senate Bill 226 is a recommendation from the 2019 JLARC report on the workman's compensation system. It is a bill that really seeks to address a couple things that the report highlighted. First off, they noted that in that report that while most claimants and defense attorneys viewing the Virginia workman's comp application process indicated it's fair, injured workers are sometimes confused about how to access and navigate Virginia's workers' compensation system. JLARC survey and interviews indicate injured workers were confused about several issues, including the existence and role of the Virginia workman's comp process, and the need to file a claim directly with them and to protect their workers' rights and compensation benefits, and the right to file a claim with the VWC disputing an insurer's denial of benefits. So this is really clarifying language. I think a lot of us saw over the last year with the Virginia Employment Commission on a separate issue, very much early confusion just on the direction and process. This is very similar to the workman's comp process in making sure that early information is very clear. And so you see the language in the bill stipulates the individual's responsibility to file the claim within 2 years. It's very clear, but it's upfront about what the role of the commission is, what it needs to do, and what the individual needs to do to take action. Now, since the report, there have been improvements on the language and reporting, but sometimes that first piece of paper is the important step, especially when someone is getting denied for an injury that they think they have a right to claim. And that's why this is, I thought, is important, especially based on our experience, I think collective experiences over the last year with the Virginia Employment Commission. Sometimes that first information of clear, concise roles and responsibilities are really important. So I know you may have some oppositions about cost of it today. This is literally a one piece of paper notice. Sometimes that is the critical step, Mr. Chairman. Happy to answer any questions.
All right, any questions of Senator McPike? All right, anyone in the audience in support? Please come forward.
If you are in the Zoom room and would like to speak in support of the bill, please raise your hand electronically now.
Go ahead.
Mr. Chair, Aaron Rice, on behalf of the Virginia Professional Firefighters, we support the legislation as so articulated by the patron. Thank you.
Okay. All right, what do we have online?
Mr. Chairman, we have one speaker, Mr. John Wright.
All right, Mr. Wright, quickly, you're up.
Thank you, Mr. Chair, members of the committee. John Wright on behalf of the Frederick County Professional Firefighters in Winchester. We support the bill. A lot of employees are not aware of their rights under the Virginia Workers' Compensation Act in order to file a claim. And I'll just mention that over the last 2 years, we have seen a significant increase in the number of claims that are being denied by the insurer with no reason given other than a broad statement that the facts surrounding the incident failed to meet the Workers' Compensation Act. So this would just simply allow those employees to know their rights, that they could file a claim with the commission. Thank you.
All right, thank you. All right, any more questions of Senator McPike? Senator Marston.
Thank you, Mr. Chairman. The first obligation of any law and any policy that we put in place is that it's clear to people and it helps them get to the conclusion that they want, whether that's positive or negative. Therefore, I would have a motion to report the bill.
All right, it's been moved and seconded that I asked, is anyone in opposition? Oh, I'm sorry.
Want to make sure you get a voice. Not to slow the train down.
Thank you, Mr. Chair. Again, John Hurd on behalf of the Virginia Self-Insurers Association and Metis Holdings, which is the company that oversees VACO's risk pool. We oppose the bill because it would require employers and insurers to provide information that's duplicative of notices already provided to the injured employee by the Workers' Comp Commission. The Commission currently publishes and sends out their Injured Workers Guide to injured workers as soon as the Commission receives the first report of injury. The guide spells out in no uncertain terms what a claimant should do if their claim is denied by the insurer or the employer. In the guide section entitled Procedure if Claim is Denied by Employer, the injured employee is advised as follows, and I'll quote, "If the employer/carrier denies the claim or refuses to make certain payments, this does not mean you are not entitled to benefits. It only means that the benefits will not be voluntarily paid. The employee should then send a written request for a hearing to the Commission." End of quote. Now, a link to that guide is also conspicuously posted on the Commission website's Injured Workers page. Employers and insurers already pay the Commission an administrative tax annually that funds the Commission's operating expenses, including paying for the creation and mailing of these documents and notices. This bill would force them to expend additional funds and efforts on something they've already paid for at the Commission and something the Commission's already doing. There is one other important aspect of this bill that hasn't been brought up yet, and I'd call the committee's attention to lines 42 and 43 of the bill. On lines 42 and 43, the bill basically says you can obtain legal advice about your claim by contacting the Commission. And that's something that the Commission just doesn't do. That line should certainly be stricken from the bill. And we would ask that you not advance this legislation, period. Thank you.
All right.
If you're in the Zoom room and would like to speak in opposition of the bill, please raise your hand now. Mr. Chairman, there is no one wishing to speak in
All right,
opposition.
The bill's before you.
Mr. Chairman.
Senator Norman.
Consistent with what Mr. Hurd just said, and shockingly enough, I did pull up the printed copy of the bill, and I would respectfully move that starting at the end of line 42, the language, you can determine the applicable time limit for your claim by contacting the Virginia Workmen's Comp Commission. I'd move to delete that, as I think it's duplicitous.
All right, you all heard the suggested amendment?
Second.
All right, there's been a motion and a second to amend the bill as stated by Senator Norman. All those in favor, say aye.
Aye.
Opposed? Oh, no, the amendment's accepted.
Mr. Chairman.
Senator Newman.
Jeremy, why not get the Commission to send this information? Why kind of put this on the employers? In other words, could we not have, along with all the data that's coming to them today, this information provided within that document as opposed to the employers or the insurance company of each employer having a new responsibility to put this in their documentation?
Yeah, Mr. Chairman, I think it's about the timing and sequence. I don't disagree with the prior speaker in terms of the sequence of initial packets of information, but I think what is important is the sequence of denial that comes back through the employer, and that's why this is coupled with that, to make sure that then when they understand that action, they also understand their individual responsibilities to file within 2 years of the injury itself. Remember, there's a timing and sequence, and so I think it's important that it be very clear up front with the timing of that denial. I think some, systems and bureaucracies can be very confusing, and I think having this up front, helping to navigate that earlier versus, one of us getting that constituent call furious about, they didn't know. Well, yeah, I agree with the previous speaker that it's in a big packet that you get in other rights and claims. In the future, the claim comes denied back through the insurer. There's a lag in sequence, and so it's really about the sequence of the paperwork and the information coming. That's why I think this is important that we help to simplify the process a little bit, Mr. Chair.
All right, the bill's before you as amended. Is there a motion?
Second.
All right, the motion and second to report the bill as amended. All those in favor, vote aye.
Senator Obenshain, how do you vote?
Senator Obenshain votes no.
Ayes 12, noes 2, 1 abstention.
Thank you, Mr. Chair.
All right. Senator DeStaff, 289.
Sir, Mr. Chairman, members of the committee, if it's okay, I'm going to hit a couple of points on this and then turn it over because we have some.
It's reported, it has to go to finance.
That's fine. Well, we've got some folks here that would like to speak on this as well. And Mr. Chairman, what this does is it's related to workers' compensation, anxiety disorder, and depressive disorders incurred by law enforcement officers and firefighters. In their career, police officers and firefighters experience more trauma than the citizens they're sworn to protect will see in a lifetime. For far too long, the psychological trauma experienced by law enforcement officers as well as first responders has been ignored. This has forced these heroes to hide in the shadows and deny themselves with the assistance they deserve. The consequences of this are devastating and will last a lifetime. Just like a physical injury, suffering during their careers, the psychological scar of trauma will last a lifetime. Mr. Chairman, we're not trying to pass a bill here to retire our officers early or on disability. We're simply trying to ensure their emotional injuries are treated under workers' comp so they can continue to effectively serve. Last week's suicide by an active duty Virginia Tech police officer is a harsh reminder of the problem our profession faces. That officer was directly exposed to the mass shooting there, as well as to the line of duty death in that agency. He had worked and actively serving and suffering in silence until he took his own life. And Mr. Chairman, this bill is supported by the Sheriff's Association, Virginia Association of Chiefs of Police, Professional Firefighters, State Police Association, and the PBA. I'd like to let some of those talk, and then I'll wrap it up when they finish. Thank you, sir.
Okay, before
Mr. Chairman.
you go, is there any questions?
Yeah, I got it.
Senator Newman.
Sir.
Is this a presumption bill or is this an allowance bill? Because it doesn't say presumption that I can see, but if it's an allowance bill, I get it, but is it a?
I believe it's an allowance bill, but I'm not positive.
Okay, while the
I'm
testimony
sure-
goes on, if staff could help with that, it'd be helpful, thank you.
Mr. Chairman.
Go ahead.
If it's presumption or allowance, wait.
I do not, I'm sorry. Mr. Chairman, members of the committee, thank you. This is truly a bill that I wish I did not have to come up here and testify about. But suicide amongst law enforcement officers and firefighters, but I'm particularly familiar with law enforcement. I don't know that it's fair to call it an epidemic, but it is a serious and growing problem. Last year, 2021, 180 law enforcement officers took their own lives. The year before that, 185 law enforcement officers took their own lives. This year, here we are, the 24th of January, and 7 law enforcement officers, and you heard about one of them, have already taken their lives. And I can think back in my own career, 2 incidents in particular that happened, one on Memorial Day and one on the 4th of July. And I have not had a Memorial Day or a 4th of July for 40 plus years, but what I don't dwell upon those incidents. I consider myself to be a very normal police officer, retired police officer, I guess I should say. But I know the suffering that's going on out there, and I'm talking about suicide. I haven't even touched upon marital problems, drug abuse, alcohol abuse. It's a significant problem in our community, and I think that this is a bill that could help address that and get these people the help that they need before something really, really tragic occurs. So thanks to Senator DeStaff, and would appreciate your support of this. Thank you.
Okay.
Mr. Chairman.
Speaking, Senator Servo.
Sorry, I have just a question, I think, I guess Tom's not here, is he? I'm sorry, you're here. So, thank you. So, got it. So, my recollection as to how this got started was that, I believe it was in 2019, the Court of Appeals came down with an opinion which said that because firefighters and law enforcement officers see really bad and ugly stuff
every day that post-traumatic stress disorder should be expected or something like that, and therefore it's not compensable as a workers' compensation related event. And that was why we passed the legislation in 2020, I think, that made clear that law enforcement and firefighters could seek workers' comp for PTSD. And that's my recollection as to how we got here. Is that right?
Mr. Chairman, Senator Sherville, I believe Senator Sherville is correct. This is Tom.
Oh, there he is. Okay. Great. So the second question, to follow up on Senator Newman's question. So Tom, does that mean the bill doesn't create a presumption, it just creates the opportunity to seek workers' comp if you can show you received either that you were diagnosed with depression or anxiety as a result of your something you witnessed while you were working. Is that right?
Mr. Chairman, Senator Sherville, yes, sir, you are correct.
Okay, great. Thanks.
Thank you. Okay.
Mr. Chair, Aaron Rice, on behalf of the Virginia Professional Firefighters, we support the legislation. Untreated anxiety and depression can lead to other health complications such as heart attack, and we've already heard about suicide. So we do support the bill. I know our firefighters and EMS providers are under tremendous anxiety right now with the COVID pandemic, under the fear of them contracting it, bringing it home to their families, or even working overtime shifts due to staff shortages. So we ask you support the bill. Thank you.
Next.
Mr. Chairman, Ed Rhodes representing the EMS community, and we support the bill and ask that you support it also, and thank you.
Thank you. Is there anyone in the audience opposed to the bill?
Mr. Chairman, we have 3 individuals in the Zoom in support of the bill wishing to speak.
Okay.
Mr. Chairman, if I may, Maggie DeBoer is probably the most articulate and knowledgeable on this of the speakers that I have. If we could, she's going to be pretty sharp.
You're up.
Good afternoon, Senator. I just wanted to hit on a couple quick points. In addition to the personal stories that I can share, I'm not going to do that today, but I want to talk about this document that we just got today. This is a national mental health survey that was done over the course of the last 6 to 8 months. And it's the first survey that we've ever had that has clinical data, embedded tools in there to diagnose the mental health of our law enforcement and our firefighting community. It's the first of our kind to do that. And the results that we got this morning that support this bill are quite staggering. And I will make a copy of that available to you. But that survey alone says that 9% of the first responders and we have a Virginia summary of this report. 9% receive scores indicating clinical levels of depression. 20% receive scores indicating clinical levels of anxiety. 12% receive scores representing clinical significance on the PTSD assessment scale. 21% respondents indicated problems with alcohol abuse. More importantly, and we talked about the suicide, 8% reported experiencing thoughts of passive suicide ideation, which means that they've thought about suicide or self-harm, but they have no plan. 4% had active suicide ideation thoughts and a plan to carry it out. 4%, that's 40 first responders out of every 1,000 that took this survey. 80 out of every 1,000 that took it have passive suicide thoughts now. We have got to find a way to address this. I mean, I understand that most of the opposition to this bill would be strictly around costs to fund workmen's compensation. We know it's not a presumption bill because it has to apply to 5 qualifying events in the code now, and that exposure has to be diagnosed by a mental health clinician. Just so you know that right now, many of our first responders are going to general practitioners and trying to get help for their problems based on these conditions, and they're being prescribed medication and other things that are not dealing with the problem. So I fully ask that you
All right.
support this bill. Thank you.
Okay, thank you. All right, next is John Wright, and quickly.
Thank you again, Mr. Chairman. I'll be brief. We support this bill. I'll just add one component. Just last year for firefighters, more than twice as many firefighters died of suicide than while on duty, and this has been the case in every year since 2014. So anything we can do to help with mental health, we would appreciate it.
Thank you very much. Ms. Lindemeyer?
Hi, my name is Chelsea Lindemeyer. I'm a police officer with Virginia Beach Police Department. I'm in support of this bill as it would extend the protections to first responders and the trauma that they endure We can't fail them, so let's not put the cost over mental health of those serving us day in and day out.
Okay, thank you. All right, Senator, you want to wrap it up?
I'll just wrap it up real quick.
Sure.
And again, the study that came out today is the National Wellness Study. And what's kind of alarming is in the state of Virginia, just in law enforcement, 2,600 people responded to this survey. 4%, so over 100 individuals said they're actively planning their suicides. And Mr. Chairman, when our fire chief came on and said that we lose twice the amount of people from suicide than we do on duty for our firefighters, that's truly alarming, and that's the catalyst behind this bill. With that, I hope the committee would pass this bill.
Okay, bill's before us.
I move the report, Mr. Chairman.
Just one quick, Senator, to staff, would you consider what took place on January 6th for our law enforcement and what happened in the following days in terms of suicides, a clear example of what we're talking about?
Mr. Chairman, Senator Morrison, I will tell you that any incident where a shot's fired, where somebody's life is at risk, where you've seen a dead person, where you've seen somebody with their head blown off, you've seen them with their bodily parts severed off, that anything like that, any incident like that, it brings on anxiety and depression.
So the answer is yes.
Yes.
Thank you.
All right, the bill's before us. Motion and a second to report. Okay, all those in favor of reporting Senate Bill 289, vote aye. Those opposed, nay.
Mr. Chair, the motion will be report and refer to finance.
Oh, okay, yeah. Yes, it would be to report and go to finance, refer to finance is the motion. All right, and a second. All those in favor vote aye.
Senator Obenshain, how do you vote?
Senator Obenshain votes aye.
Mr. Chairman, as a member of the committee, thank you very much.
Ayes 15, no 0.
All right, Senator Vogel, you're up.
Thank you, Mr. Chair and members of the committee. I have Senate Bill 321, and this, compared to everything else you've heard, hopefully is super simple. This changes the definition in Virginia's code of autism spectrum disorder and deletes some language that is out of date and actually no longer consistent with how autism is defined today in DSM-5, and frankly just ties it to the most recent edition at the time of diagnosis of the DSM manual. So it removes the word autistic disorder, Asperger's, Rett syndrome, and the like, which is frankly no longer the actual medical definition of autism spectrum disorder and really not consistent with the science. And so with that, I think I have two people who wish to maybe offer additional explanation.
Okay.
Would report.
Second. All right, there's a motion to.
Thank you, Mr. Chair.
Report and a second. All those in favor of reporting 321, vote aye.
Senator Obenshain, how do you vote?
Thank you, Mr. Chair and members of the committee.
Ayes 14, no 0.
All right. Senator Boysko, you're up.
Thank you, Mr. Chair. If you thought that was easy, I've got one that's even easier.
You have 449.
449, yes, sir. Mr. Chair and members of the committee, I have SB 449, which would preserve coverage for medically necessary formulas for inborns who have metabolic disorders. In 2020, we unanimously passed legislation allowing these necessary medical foods for those diagnosed with rare inherited metabolic disorders. However, the Centers for Medicare and Medicaid Services stated that the requirement would be a new health insurance benefit rather than an expansion of the existing benefit. So this bill is necessary to be on our Virginia plans. In 2021, CMS indicated this requirement would need to be taken care of. This is all following a Health Insurance Reform Commission study through JLARC and the Bureau of Insurance Studies. And I have some people here who are happy to talk about it if you wish. I have no understanding of any opposition. We've worked with the Health Association plans. I have Andrew Lamar with the Virginia Academy of Nutrition and Dietetics, Carter Beatty with the Children's National Health Insurance, and others. And I hope it's the pleasure of the body to report the bill.
All right, motion and a second, report 449. All those in favor, vote aye.
Mr. Chair, this-
Hold on, is that, no, not. That has to go to, the motion should be a report and refer to finance.
So move.
Second. All right, all those in favor of reporting and referring to finance, vote aye.
Senator Obenshain, how do you vote?
Senator Obenshain votes aye.
Ayes 15, no zero.
All right,
Thank you.
Senator Donovan, you're up.
Thank you, Mr. Chairman, members of the committee. First of all, thanks for disposing of two of my bills so artfully. The first bill that I'll talk about today is Senate Bill 407, and I believe there's a substitute. Tom?
All right, there's a motion, a second for substitute. All those in favor?
Mr. Chairman, Senator Donovan, did you mean 427?
Yes, sir. Are you on? Yeah, 407 was passed by for the week. We're on 427, and there's a
427.
substitute for that.
Yes, ma'am. The substitute will be available online shortly.
Mr. Chairman, this bill works. This is related to some legislation we passed a couple of years ago to allow others outside of the health plan or the individual to pay the part of a copayment for a prescription. And in designing the legislation, we inadvertently caused a snag for our bankers with the association health plan that they have. And the language of this bill, which I am now struggling to see on the amendment, basically just corrects that language so that they are able to both have their deductibles and their health saving plans and apply it appropriately without any damages to their members. And I think I have the bankers here to speak about this today and can give you more detail.
Mr. Chairman, Senator Donovan,
Tom?
Sorry, I'm confused. Is the senator describing SB 427 or SB 433?
I am so sorry. I'm describing 433. But I'm glad to keep you on your toes, Tom. Thank you.
Yes, ma'am.
You on mine. I know, I couldn't find it either in my version.
Yeah.
Sorry, guys.
All right, you want to explain 433?
That is the one I explained. I just gave you the wrong number. This is the one that has the modification to clarify for the bankers. Right explanation, wrong number.
The banker had a problem with 433, I'm pretty sure.
All right, Matt.
Thank you, Mr. Chairman, members of the committee. Matt Breen with Virginia Bankers Association. Appreciate Senator Donovan putting the bill in. I think there's a technical line amendment on line 41 that corrects the citation of U.S. code with the IRS provisions. What this basically is doing is making sure that, as the senator explained, is conforming with our HSI high deductible plans, making sure that third parties can contribute and not make it ineligible as an HSA. It's actually language that comes from the National Council of Insurance Legislators, NCOIL. They adopted this model legislation earlier this fall. Cleanup, and obviously, as holders of HSA accounts, we want to make sure that there's nothing that's going to run us afoul of state law and make those accounts ineligible. So here, that's why we have the bill before you. Appreciate your support.
Mr. Chairman, Senator Donovan, yeah, there were just two technical amendments to this bill. As he mentioned, on line 41, strike 233, insert 223. And then on line 44, strike preventative and insert preventive.
Could you read the second one again?
It's changing the word preventative to preventive
Okay.
on line 44.
All right.
Thank you. Sorry.
All right. Are there any other questions of Senator Donovan on 433?
Move report.
Hold on. Is there any opposition to the bill? Anyone online?
If you're in the Zoom room and would like to speak in opposition of the bill, please raise your hand electronically now. Mr. Chairman, there are no speakers.
A second. All right, there's a motion and a second to report Senate Bill 433 and not 427.
Yet.
Okay. All those in favor, vote aye. Those opposed, nay.
Senator Obenshain, how do you vote?
Senator Obenshain votes aye.
Ayes 15, no zero.
All right.
Thank you, Mr. President, Mr. Chairman, for your patience and that vote. Now we're going to go to Senate Bill 427.
You sure?
I hope so. So 427 is a means of working to help with credentialing physicians. You know this is an ongoing problem. We made it possible a few years ago to allow physicians to retroactively bill if their credentialing through the health plan was approved. They were able to retroactively bill and collect those fees. If they were not approved through the health plan, they couldn't collect for the patients that they saw. The problem is that there was some uncertainty about when the date for billing began. So this bill simply gives both an electronic, there's an amendment here, I think this is the one that has a substitute that Tom can help us with, but basically it just seeks to clarify if it is an online application, that there's pretty much an automatic verification that the application is complete, and if not, that they're notified when it's complete within 10 days so that the clock can start.
Okay. Any questions of Senator Donovan? All right. Anybody
Tom, is there an amendment or a
audience
substitute?
in support of the bill?
Yeah, Mr. Chair, Senator Donovan, yes, the senator described the substitute accurately. It's available online.
So we need to move the substitute. Yeah.
All right. All those in favor of adopting the substitute, say aye. Aye. Opposed? All right, the substitute is before us, and you want to, you're in favor of the bill?
Yes, sir. Clark Barano in the substitute. Clark Barano with the Medical Society of Virginia. We appreciate Senator Donovan's leadership, and we have peace in the valley with Mr. Doug Gray. So we move to report. Thank you.
Doug?
I'm Doug Gray on behalf of the Virginia Association of Health Plans, and we thank the patron and medical side for working with us on the bill. I would note that you earlier announced this bill was in a subcommittee, so I don't know if that's a problem,
Yeah,
but
no,
just thought I would mention that. And I think
we decided we decided to take it up.
Okay, and
Okay.
I think Tom has the right language because
It is.
I haven't seen it.
Do you want to see it?
Well,
I'll send it to you.
I'll trust it.
Yeah.
All right. There's been a motion to report the substitute and a second. All those in favor, vote aye.
Senator Obenshain, how do you vote?
Senator Obenshain votes aye.
Ayes 15, no zero.
Thank you, Mr. Chairman, members of the committee. I'm glad I could lighten your afternoon a little bit.
Senator Evans not here. Okay. See, Senator Eben, not Edwards, Eben. All right, Senator Barker. 335. But first, we need to roll Senator Cosgrove's bill into Senator Barker. All those in favor of, they're pretty much similar bills. All those in favor of doing just that, vote aye.
Aye.
I think you got to go up on the, got to record it.
You need a motion?
Senator Obenshain, how do you vote?
Senator Obenshain votes aye.
And I vote aye.
All right, George, what are you doing?
Oops, hang on, sorry.
All right.
This is a bill we've seen before.
Yes. This is almost identical to what we had last year and
the year
very
before.
similar to the year before. So this year we're going to get it done, I think. So they're about 35,000. There are about 35,000 realtors in the Commonwealth, are members of the Realtors Association. And of those, about 20%, about 7,000 people, don't have health insurance coverage because they don't have the mechanism that most employees would have with their company being able to do things. This is compliant with all the factors related to the Affordable Care Act. So it's met those, and actually in a couple of cases actually exceeded them. Rather than doing, if under the Affordable Care Act, there can be different rates charged in different geographic areas within the Commonwealth. This makes it a single statewide pool, so there's no difference in preferences established there. Similarly, on the standard for the private insurance plans is a maximum differential in premiums based upon age of 5 to 1, so that someone who's in, say, their 60s or so would get a rate that's about 5 times what someone in their 20s would get. This actually narrows that down to 4 to 1, so that actually makes it more easier for those people who are already in sort of the middle age or late stages of their career to be able to get the health insurance coverage. And so there are significant benefits here, and I would hope it'd be the pleasure to adopt it.
Senator Norman.
Senator Barker, this is way outside of my wheelhouse, but I did notice that one of the provisions, why is the Medicare Part D plans not bound by the board's decision?
Where are you looking at?
I'm looking at the summary of the bill. Last line in the first paragraph, Medicare Part D plans shall not be bound by such decisions of the board. And I don't know what I'm talking about.
And I'm not seeing that here, so.
I apologize, I just.
Okay.
I withdraw that question.
Okay, all right. I'm finished, so you
You're
can go ahead
done.
and.
All right, any other questions? All right, those who are here present in support of the bill, anyone here in support of it? No one's in support of it.
Mr. Chairman, we have one individual online that wishing to speak in support.
Okay. All right, go ahead.
Hi there, Chris Condalucci on behalf of the Virginia Realtors. We are here to support the bill, and I'm here to answer any technical questions if anyone on the panel has any.
All right. Yes. Okay, thank you very much. All right. The bill is before you. All right.
Move report.
Motion and a second to report for the umpteenth time, 3:35. All those in favor vote aye.
Senator Obenshain, how do you vote?
Senator Obenshain votes aye.
And I vote aye. Where is, oh, here it is. Okay, I didn't see that.
Ayes 15, no 0.
Okay.
All right.
You have 434.
Yes, I do. I have 434. There is a substitute for 434. 434 is trying to help us get more information on mental health parity as it relates to insurance coverage. And what this bill does, there was a report done through the JLARC that provided some significant useful information. What this does is try to take it a step further so that we can try to work with the plans and others, advocates on things in terms of providing adequate coverage for mental health services being done. There are various, actually pretty extensive data that are collected on a base that's required to be collected from the insurance plans and others and be submitted. It's just not been available to the public.
Right.
And what this would do is make that data available so that there could be analysis of it and we could look at it and sort of see how we're doing and try to make sure that we're helping the insurance plans be able to meet their responsibility for mental health parity.
All right, there's a motion and a second to adopt the substitute. All those in favor of adopting a substitute to Senate Bill 434, say aye.
Aye.
Opposed? All right, the substitute's before us.
I have a question.
Senator Norman.
I think I'm on the right bill this time. Okay. My question is, how onerous is this going to be on the State Corporation Commission's Bureau of Insurance and, more importantly, on the health carriers?
It will actually provide a little bit of extra work for them just to make sure that the information is available, but right now, the information is submitted to them, so they don't have to do anything else, and this would just provide an opportunity for others to be able to analyze it and look at the issues.
Okay.
Good report.
Senator Newman.
George, is the desire here that you know what's in the policy? Is that, and make sure it's lining up with federal requirements, or kind of, what's the need to do it?
Yeah, I mean, what the analysis that was done by JLARC when they looked at this issue not too long ago was they were looking at how many claims were rejected for mental health services that were provided compared to other services and those types of things. What this does is it provides a lot more information so they can make independent decisions about, through the analysis on things, of whether or not what the actual information that was provided there is sufficient to be able to say that in this case, they should have had a service. In other cases, they should not have had coverage on that. And so it's basically trying to get the information there so you can make those decisions, make those analysis on things. Right now, we just had the information on the aggregate, and clearly there's more ambiguity in some situations in which people have are providing mental health services, because it's not like you can say you got a cut on your leg and you have to stitch it up. This will help in terms of getting the services provided when necessary, but not resulting in payments when it's not appropriate.
Okay.
Move report.
Second.
Motion and a second to report the
Mr. Chair,
substitute of
report and
434
refer to finance.
and refer to finance.
Okay. Yeah.
All those in favor of reporting and referring to finance, vote aye. Those opposed, nay.
Senator Obenshain, how do you vote?
Obenshain votes aye.
Ayes 15, no zero.
Thank you.
All right, Senator Rabin, you have
SB 311.
Yeah, there's some question as to whether that should wind up going to the Judiciary Committee.
Oh, Judiciary? This has to do with a realtor's duty to disclose ownership interest and if there's a problem with the title.
Well, are
you sure it wouldn't be general laws?
Well, you have title insurance in here, so
Well,
right
the
now the bill's
substitute,
here.
the substitute actually removes the portion.
Well, if a substitute what?
The substitute removes the portion dealing with the title insurance.
Well, if that's the case, it does not belong here.
That's what I thought. It said bills to be referred on the sheet, so I was
Yeah,
assuming it would get referred to general laws.
Tom Stevens thinks it should be referred to the Judiciary.
Oh, Judiciary? Okay.
Yeah.
Mr. Chair, general laws or judiciary, I think would be appropriate.
Mr. Chairman, I move that the bill be referred to the Judiciary Committee, sir.
All right, and is there a second? All right, motion and a second to refer to Judiciary. All those in favor vote aye.
I never got it now.
Senator Obenshain, how do you vote?
Sir Obenshain votes aye.
Scott?
Okay.
Ayes 15, no zero.
All right, and Senator Servell, yours the last one.
Senator, I have one that's very simple.
Hold on, wait a second. I may be wrong, Edwards.
It's 422. Very simple bill.
Passed by indefinitely.
You'll like it, you'll like it.
I didn't have it. I don't, oh yeah, I had 422's here. Okay. Yours will be next. Servell, you're up. $351.
Thank you, Mr. Chairman. Senate Bill 351 has to do with workers' compensation events when an employee is injured, and then after they're injured, they suffer another injury a period of time after the first injury, but it's related in some way to the first injury. So the Supreme Court of Virginia came down with a case in 2021 called Merck versus Vincent, which basically said that the Virginia Court of Appeals, before we added a bunch of people to it, decided a case incorrectly by applying the what they called the compensable consequence doctrine to a situation where a guy, he got injured at work pulling a box out of his car or something, and then I think it was a week or 2 or 3 later, he was at home. The medications that he had taken caused him to become woozy, and he fell down some stairs, and the Workers' Comp Commission gave him a complete disability for that, and they said, the Supreme Court said they shouldn't have done it because the falling down the stairs wasn't part of the same accident as the original pulling the box out of his trunk. In any event, I'm not a workers' comp lawyer, but in talking to workers' comp lawyers, they said that this disrupted what had been commonly understood to be the law in many cases for a long time. And so I put in this bill, which basically makes clear that you can use what's called the compensable consequence doctrine to obtain benefits if you have a second injury after the first one, and which would have reversed the result in this case. So in other words, you have to show that you wouldn't have been injured the second time but for the first injury, and then you can get full benefits. And there's a lawyer here who can probably be a lot more articulate than I am on this, who does this for a living, who's, I don't know if he wants to come up and answer any questions if there are any, but nobody has come to me to tell me there's any opposition to this bill, so I assume there is none. And that's basically what the bill does.
Mr. Chairman,
Senator Sproul.
a couple of questions. My first question is, so if I get hurt on the job and I get comp, the sucker accident had nothing to do with my job. So you're trying to say that I can use the excuse you're saying because the medication I'm getting from the first accident caused the second accident? And if that's the case, then you can get some benefits.
It has to do with not just any benefits. It has to do with getting, being found to be, I believe, fully and totally disabled. Not any benefit, but only fully and totally disabled. And you basically would have to show that the second incident, where you really got hurt bad, arose out of your medical treatment from the first one.
Mr. Chairman, then, I'm sorry, Mr. Chairman. What happened then if the second incident was not really bad, but it hurt enough when it would keep me further from going back to my job? What happened then?
He could probably answer that better than me. Why don't you ask, because he does this for a living, whereas
You understand my question?
I'm an armchair expert.
Now, don't try to fool me now, because in 2 weeks now, I will pass the bar for my law and order watching TV.
There you go.
So don't try to fool me.
Casey Ariel, Chair of the Virginia Trial Lawyers Workers' Compensation Section. Mr. Chairman and committee members, I understand your question. This bill is meant to address a very specific issue that came up in Merck v. Vincent in regards to permanent partial disability benefits and specifically permanent total disability benefits. What you're describing is the more routine use of the compensable consequence doctrine. So if you have an injury that the actual injury leads to something else that is a consequence of that injury, it is treated like any other injury that occurs in workers' comp. So it doesn't matter the severity of it as long as it requires some sort of treatment or otherwise. But this bill specifically is talking about including it under the permanent partial disability
Mr. Chairman,
statute.
then last question then, the second incident is not serious. So can I apply for benefits on the second incident? It's not, doesn't have a thing to do with the first one. I understand that. And the second one is not a serious one, but I am hurt, and can I apply for benefits for the second incident that is home-related and get into the first? Can I apply for benefits? It's not a death, it's not a real serious one, but I want to apply for it. Can I do that?
You can, if that happens at work under the original.
Not at work, home.
If it's not related at all to that original first injury in any way a consequence.
Mr. Chairman, if I can try to help him, I think his question is whether or not it is not a serious injury.
That's right.
If the second incident is not a serious injury, is it compensable under this proposed bill?
It's a different issue, but in legal, in our field, yes, but has nothing to do with this bill.
See, I'm smart. 2 weeks,
No,
I get my degree from law and order in 2 weeks.
Yes, sir. Yes, sir.
Mr. Chairman.
Senator Newman.
Scott, is there more language other than what's on 51 and 52? Is it only related to those injuries mentioned on line 51?
Yes.
So it's only losing both feet, both legs, that all the items. So it's not for everything. It's just for those very specific things. Is that correct?
Correct.
Okay. Chairman, I move the bill be reported.
Second.
All right. Is there any opposition to the bill? All right. Anyone online?
I'm sorry, Mr. Chairman, there's a slight typo that needs to be fixed. Line amendment.
I withdraw my motion, Mr. Chairman.
All right.
I withdraw my second. I move the alignment. Second.
What does the line amendment do?
It strikes, on line 4, it strikes 65.25503 and replaces it with 65.2503.
What does that mean? What does that mean?
There's an extra 5 in here.
That's all.
Mr. Chair, Senator
A number
Serval,
mistake.
the
Okay.
section number is mistyped in the title of the bill. It's a technical amendment that just corrects
All
the
right.
section number.
Move the amendment.
All right.
Second.
Amendment's been moved and seconded. All those in favor of adopting the change, say
Aye.
Aye. All right, bills before us.
Second.
All right, there's motion, second, report 351 as amended. All those in favor vote aye. Those opposed, nay.
Senator Obenshain, how do you vote?
Senator Obenshain votes aye.
All right, Senator
Ayes
McClellan,
15,
you're
no
up.
zero.
Good afternoon. I have Senate Bill 469, which was a unanimous recommendation from the Joint Commission on Healthcare as part of its study on health insurance affordability in the individual marketplace. What the bill does is would require the Virginia Health Benefit Exchange to prepare an annual marketing plan that would include consumer outreach and navigator programs. In our study, the Joint Commission found that increased public awareness and assistance for applicants is a cost-effective way to increase enrollment in the individual market and thereby reduce the number of uninsured and add a sufficient number of young and healthy individuals to the marketplace to help balance the cost. Nationally, more than half of those surveyed between the ages of 18 and 34 are unaware that they even qualify or may qualify for financial assistance through the Affordable Care Act and aren't aware of their health care options. And again, by adding younger and healthier enrollees, this is one of the most effective ways to keep health insurance premiums low. And the commission recommended this as one way to do all of that.
Okay. Just added to the Exchange Act as a list of one of the items. All right, bills.
Oh, I'm sorry. I do have a line amendment. Can I see?
Where's it going?
So on line 115, so this would add after outreach, comma, licensed health insurance agents. So this would include consumer outreach, licensed health insurance agents, and navigator programs so that the...
All right, you heard the amendment. Sorry. Motion is second to adopt the amendment. All those in favor adopting the amendment, say aye. Aye. All right. Any questions of the patron by the committee members?
Move to report as amended.
Second.
All right, motion and a second to report. 469 as amended. All those in report and refer to finance. All those in favor say aye. Aye. Or vote aye. Excuse me.
Senator Obenshain, how do you vote?
Senator Obenshain votes aye.
Ayes 15, no zero.
Thank you, Mr. Chair.
Bill is reported and referred to finance. Okay, Senator Edwards, you're up. Is there a second?
Mr. Chairman, members of the committee, this is a follow-up on the Joint Commission on Healthcare recommendation. One of the recommendations to make health insurance more affordable for more people. Currently, the insurance companies can charge you more if you smoke. It turns out the studies show that doesn't work. In fact, in Virginia, localities that have some of the highest uninsured rates also have the highest tobacco use rates. The more you smoke, they charge you more, but it discourages people. The rates are up because of they're charging more for smoking. The opposite actually works. And so the Joint Commission on Healthcare, among its recommendations, made a unanimous recommendation to take out the provision that the insurance companies can charge you more because you're smoking. You may think it's counterintuitive, but that's what the facts show. For example, the staff looked at several things and worked with the Urban Institute about how to eliminate the tobacco surcharge. And the model estimates the following. One, it may cause premiums to fall between 3% and 4.5% by not charging more for smoking. And the second thing, it would increase the number of people in the individual market from 9,000 to 13,000. In addition, it would reduce the number of uninsured by up to 14,000. So we're deleting the option to charge more because you're smoking. And doing that, it reduces the price of insurance across the board.
I've got a hard time following that logic.
Well, it may be counterintuitive because the idea was charge people more for smoking, they won't smoke. It doesn't work. It doesn't work. They just don't, it causes insurance, people not to
Maybe
buy
they're not
insurance.
charging enough.
Well, anyway, that's what the study shows. Unanimous recommendation, Joint Commission on Healthcare.
Mr. Chairman?
Yeah.
Senator Evan.
Yeah, Senator Edwards, you said that that the opposite was true. What is the opposite? You just
Well, to reduce health insurance, don't charge them more because they're using tobacco, because they're not buying insurance, because it causes the cost of insurance to go up.
Senator,
if you don't charge for extra for tobacco use, the price goes down across the board.
Thank you, Mr. Chairman. I think this involves sort of the opposite of this is a bill that was voted out on the floor the other day, I think 19 to 17, where you can create an incentive to smokers or people to take vaccines or a number of other things that are elucidated in that particular section of the code. So I think that's what the senator's getting at, to make it an incentive as opposed to a disincentive.
The tobacco surcharge was originally included in the Affordable Care Act to encourage individuals to quit tobacco products. But the studies find that the tobacco surcharge does not promote quitting, and in fact is more likely to act as a barrier to coverage, especially for individuals with low incomes. They can continue smoking, and they're just going to smoke. But the price they have to pay is higher, and that discourages people from buying insurance. This is what the facts show, the studies show.
Mr. Chairman?
Senator Bell.
Mr. Chairman, question for the patron. Have we got a fiscal impact on this? Because I'm concerned. I hear what your pattern of logic, which seems illogical, but having said that, it seems like we would logically be charged more money in our health plans for this. Have we got any kind of impact statement back on this, or do we know what they're estimating? Because I think,
No.
how could they, I mean, it seems like we're taking a higher risk and there's not going to be a greater cost there?
Well,
Mr. Chairman?
if you charge more because they smoke, they're going to keep smoking and cause the price to go up. But if you don't charge them more for smoking, the price goes down. Because they're not going to quit smoking. That's the problem. It doesn't do any good. It's not a disincentive to smoking. And the studies show, again, premiums would fall between 3% and 4.5%.
The thing is, they're paying for it, though. I mean, if they're going to keep smoking, they're obviously going to have more health problems, than a non-smoker.
But you want, the point is to get the price of healthcare low, so low-income people can afford it.
Mr. Chairman, I wish y'all would stop doing that low-income people.
I got an expert here.
Mr. Chairman, let me ask a question to somebody from the insurance company. Someone from the insurance company.
Mr. Weiss here.
I want someone from the insurance company. You from the insurance company?
No, I'm with the Joint Commission of Healthcare.
No, sir. Come on, Doug, please come forward. I just want to ask a question to the insurance company. That if I come in for help that can get some insurance, then are you charging me based on that I get a physical, and if I say I smoke, you're going to raise my rates? That's my question.
That's right.
Yeah, Mr. Chairman and Senator Sproul, the ACA permits a extra charge for smokers, and in some cases, insurers do have an extra charge for people who smoke. But in some cases, the insurers do not assess that extra charge. Sometimes we find when we assess the extra charge that smokers lie. They just don't admit that they're smokers, and so we tend to have not very many people paying that fee. But that being said, some think it's worth having it as a charge, and some think not. The theory and logic behind removing it is something that the Joint Commission should explain.
Doug?
Mr. Weiss is here.
Thanks, Doug.
People who smoke tend to have more health problems than people who don't. Is that correct? Now, if they have health insurance, they're going to be using that health insurance a lot more than a non-smoker. By charging them 1 or 1.5% or whatever the number is, they're at least paying a little more for their excessive use of that health care plan. So why should we disturb that? If anything, we ought to take what you have in here and triple it.
They're not buying.
Mr. Chairman, you've explained the ACA's rationale.
Yes, okay.
Joint Commission on Healthcare expert here. Mr. Weiss.
Hi, Steve Weiss with the Joint Commission on Healthcare. Actually, what this is trying to do is get younger, healthier people into the insurance market. Under the system that we have now, when they go in and they say they're a tobacco user of any kind, they get charged after all of their tax credits and after all of their cost sharing reductions. And then it becomes an out-of-the-pocket expense for them to have insurance. And the idea is to get them into the pool while they're still healthy and not using the system as much, trying to get them into tobacco cessation earlier, as opposed to what you described, which would be true at the older ages, over 50, 60 years old. That would be true. But the idea here is to remove the barrier for the younger people who do not use the system as much, so that they would be encouraged to buy the health insurance.
Okay, the bill's before us.
Move to report.
Mr. Chair,
Does this
Senator
go to,
Edwards.
Finance?
No.
It doesn't have to go to finance. No.
Senator Edwards,
Yeah.
did you want to offer an amendment on this bill?
Which one is it? I don't know. Okay, there's an amendment here, okay.
This amendment relates to what's included in the fiscal impact statement
Okay.
to make it apply.
Amendment, the provisions shall apply to health benefit plans providing individual and small group health insurance coverage entered into, amended, extended, or renewed on or after January 1, 2023. The delayed effective date.
The amendment's been moved. Is there a second? Second. Moved and seconded. All those in favor of adopting the amendment, say aye.
Aye.
All right, bill's before us.
I move the report as amended. Again, the idea is to get people complaining about the high cost of health insurance.
Okay.
This is a model to do this.
Is there a second? There's no second, so the bill, oh, there is a second. All right, all those in favor of reporting Senate Bill 422 as amended, vote aye. Those opposed, vote no.
Senator Obenshain, how do you vote?
Senator Obenshain votes aye.
Norman is nay.
Ayes 10, noes 4, 1 abstention.
I think that's it. Any other business? I don't, her bill is not,
She's on the subcommittee.
she's in a subcommittee. Okay. She's here for the subcommittee. All right. The full committee will rise except for Senator Spruill's subcommittee.